Hi, doctor. Are you currently seeing patients with shoulder pain? What about frozen shoulder? What if I could teach you a neurological treatment system in which you could literally take a person from frozen shoulder to a full range of motion in 2 visits? And this system is so powerful that we guarantee results in 2 visits, or we don't accept the patient for care. Hi, I'm Dr. Andy Barlow. I'm a board certified chiropractic neurologist. I also carry a fellowship in functional neurology, and every Wednesday night at 5 p.m., I'm giving a 1 hour seminar free of charge. I'm here to help you. I'm here to help your community. I'm here to help our profession go to the next level. I personally look forward to seeing you every Wednesday night. I want to completely change your life and change your community's life. And I can help you do that because I've helped hundreds, if not thousands, of doctors from Europe to Canada, all the way to New Zealand with these types of health issues. Okay. So I look forward to seeing you Wednesday night at 5 p.m. Central on the webinar. Have a great day. I look forward to seeing you on the internet.
Hello, everyone. This is Mark Anthony with Edge on Regenerative Medicine Show. I am so excited. Today we have a special guest out of the Texas area. Every time I think of Texas, I think of Bonanza. Please, it's got to keep it real. And so, anyways, today we have a special guest. It's Dr. Dan Clearfield. We're going to be talking about a topic that people hear a lot about, but I never really hear anybody really explain it. And I know if I'm confused, I know the whole world's confused. Just joking. But with that being said, we're going to be talking about life as a sport and motion is medicine. You know, we hear about, I'm a sports medicine doctor, I'm a sports doctor, and what does that entail? Before we get started, everyone, you can go to motionmedicinedfw.com. That's Dr. Clearfield's website. And again, thank you so much, doctor, for being here. How are you today?
I'm doing great. How are you?
Man, if I was doing any better, I'd need a third cup of coffee. Just joking. But with that being said, tell us a little bit about you and your credentials, because you have a lot of credentials. I was going to name them, but it would have taken me about 30 minutes.
At least.
And so.
Okay, yeah, thanks. So I'm Dr. Daniel Clearfield. I'm the owner and medical director of Motion is Medicine Sports Medicine. We are in North Richland Hills, Texas, which is right by Fort Worth, Texas, for those that don't know the area. I am a DO, doctor of osteopathic medicine, and I'm boarded in family medicine and osteopathic manipulative medicine, as well as boarded in primary care sports medicine. And I have been in practice now for, I guess it's just over 10 years now, after completing both of my residency and both of my fellowships. And I started, I was teaching over at the medical school over in Fort Worth for first 5 years of practice, went into a private practice for a little bit of a period, and then realized there were some problems with our healthcare system, and I decided to be a disruptor rather than somebody that just kind of put their head down and just keep barreling forward and hoping things were going to change. And that's where I started my practice, Motion is Medicine, back in 2019. And so, we can talk about that. We can talk about sports medicine. Happy to answer any and all kind of questions. So,
well, I hear a lot about sports medicine doctors, and like I said, if I'm not sure what that is, or I'm sure a lot of people are wondering, are you currently only working with people that are in sports, or is that the majority of the people you work, or is that just a broad term?
It's definitely a broad term, and we talk about the term sports medicine physician. Sometimes it makes it seem too exclusive.
Right.
One thing I like to say is anybody that moves is an athlete. And so I say sports medicine doctors, we are trained physicians in regards to being able to treat any kind of injury that can occur, whether it be acute, chronic. So whether it be a sprain, strain, fracture, dislocation, we can manage those type of things, but we take care of a lot of chronic things, whether it be arthritis. And so what I like to say is I'm very full scope in regards to what I do in sports medicine. And so I can treat the 5-year-old that fell off the monkey bars. I can treat the 16-year-old with their concussion, the 25-year-old that sprained their ankle. the 35-year-old that is starting to have some rotator cuff issues, or the 95-year-old that has some arthritis and would just like to be able to go for their daily walk. And so really, it's that full encompassment of primary care sports medicine. So, those of us that have that background in primary care, and mine was in family medicine, we learned to take care of the whole family from baby and beyond. And so we can do the same kind of thing in sports medicine. And so, you don't necessarily have to be a professional athlete for me to be able to see you, but we're going to treat everybody like a professional athlete in regards to their care.
Wow, I like the way you said that. So you're focused on not just treating the whole family, but the whole body. It's because I know there's some doctors that are just back doctors or knee doctors. At least that's what they promote. What would you say the difference is between just a chiropractor and then with what you do? Is there really a main difference?
Yeah, well, so a chiropractor's gone through chiropractic school, and so they're a doctor of chiropractic medicine, DC. As far as licensed physicians in the United States, there's two types of licensed physicians. There's MD and DO. And so MD is allopathic physician and DO is osteopathic physician. MDs have been around as far as for hundreds of years. DO is still a relatively newer kind of profession, but it's been around since the 1800s. And so last 150 years that osteopathic medicine has come around. But same with chiropractic. Chiropractic came around the same time. And actually, the founder of osteopathic medicine, Dr. Andrew Taylor Still, he was an MD. It was during Civil War times, and he saw that there was just the way that traditional medicine was being practiced at the time. And it was a lot of amputations and bleeding people out. And he was just like, you know what, there's got to be a better way that we can help people. And he started really studying the body anatomy. He was already a surgeon himself. And he started finding a way to be able to treat people with his hands. And that's what became osteopathic manipulative medicine. And he started teaching. And so he was the first DO. So he was MD, DO. And he was the first DO. And he started teaching others as far as and it wasn't just about treating them with his hands. It was a philosophy. The philosophy was the person is a unit of body, mind, and spirit. Structure and function are reciprocally interrelated. The body is capable of self-healing, self-regulation, and health maintenance. And rational treatment is based upon practicing with these preceding principles. And so this was something that it was a newer way to kind of look at the person in a more holistic approach, rather than looking at the disease. It's not about treating the disease, it's about treating the patient. It's about looking at them as a whole, trying to figure out what's going on with them as a whole so that we can find health within the individual rather than search disease out in a person. And so that's where it's more of that holistic approach. Now, the original chiropractor, Dr. Parker, Parker or Palmer, I think it was Parker. He was a pupil of Dr. Still, and he learned some of the manipulative kind of components. And he said, "I like this. I don't want to, necessarily practice all the medicine aspects, but I like the manipulative kind of concepts." And so that's where he ran and kind of did his own thing. And so from a philosophy, there is some overlap, but there's a little bit of a different model. A lot of chiropractors very much have it from a neurologic type model, and very much a lot of the thing that stems from osteopathic is the vascular model, thinking about we want to optimize blood flow. Stasis is death, is life, motion is medicine. And so, it's about making sure that we're getting adequate oxygen, nutrients to the body areas, making sure that we're removing any kind of toxic metabolic products out of those areas. And so that's kind of Dr. Still's philosophy. Unfortunately, fortunately for chiropractors, they've marketed themselves very well. So the public knows what they do.
Exactly.
Whereas, and a lot of people can't tell if they're being treated necessarily by a physician and whether they're a DO or an MD. But the hope is that, if you cover it up, you can tell if it's a DO because they're, typically a little bit more holistic in their approach. All DOs are taught osteopathic manipulative medicine, but only a small fraction of us actually use it. It was a big reason that I wanted to become a DO and I wanted to go to an osteopathic medical school was I saw its practicality in sports medicine as far as treating the athlete. And I said, this is something that I want to be able to learn how to do. I want to have this hands-on treatment that's always available to me. And it's been a huge advantage for me as a sports medicine physician. I really don't know how I could get by as a sports medicine physician. Thinking about the patients that I saw today, I did osteopathic manipulation, I think on easily 80% of my patients today.
Let's talk about that. What does that entail, and what does that look like, and what are the normally like some of the symptoms that you had with, say, working with some people today?
Sure. And so osteopathic manipulative medicine or osteopathic manipulative treatment, OMM or OMT, using the hands to be able to correct any what we call somatic dysfunctions of the body.
Right.
And so, if somebody has a fracture, a sprain, a strain, a dislocation, these are pathologies that can occur in the body. But the spasming of the tissue, the myofascial pull that's causing a chronic strain kind of pattern. So if I take this over here and I'm yanking it over here,
right,
I'm going to start to have some issues on my body. So how do we fix this? And if I just leave it be, it's kind of slumped like this. So, a lot of our treatment really focuses on treating the myofascia, treating the muscle, the fascia kind of tissue that surrounds the body to make sure that it's optimizing the body to be able to heal itself. So we can do any of the popping techniques that the chiropractors can do, but we can also work on the myofascia. We can work on the lymphatics. We can work on any of the other areas of the body that are impairing the body's ability to be able to heal itself. So in general, when I'm looking at a patient, I always say it's like, again, going back to those principles, the body's capable of self-healing. And so if the body's capable of self-healing, why is the body not healing itself?
Exactly.
That we have a straight path that we need to walk down to get our bodies to be able to heal itself. And sometimes we, unknowingly kind of start off on the wrong kind of path. We start deviating. So sometimes it's about me just kind of explaining to the patient how they can self-correct to make sure they're walking down that path. But sometimes there's an obstruction in that path, and that's where I need to do some sort of intervention to help remove that obstruction so that they're able to keep moving forward. And that's where manipulation or sometimes some other procedures that we do are able to help the patient move better.
Well, I like the way you said that. Now, I know that our title is Life is a Sport, Motion is Medicine. So when you say motion is medicine, what does that really mean? Is it just keep on moving, or I'm not sure.
So in general, it's like, again, it's like once we stop moving, it's the end of life. It's like,
you're done. Yeah, forget about it.
I mean, from the beginning, we need to be moving. And in general, the body wants to move. And we've learned consequences. If you keep yourself immobilized, if you sit in a chair all day, your body's going to start screaming at you.
Yep.
Your hip flexors, all those things are going to start kind of screaming at you. Your body wants to be moving. Our body wants to be in motion. Muscles are full-time employees, and if they don't take the job of work, then they're going to take the job of spasm. And so it's important to make sure that we are moving throughout the day. If we have anything that's not allowing us to move the right way, that's where we need to do something corrective so that we're moving, and I always say it's like also making sure that we're moving the right way, not the wrong way. And, my interest in medicine started in high school. I became a certified personal trainer, and I kept training through college and even through medical school. But I started asking a lot of these kind of questions, and I would always try to teach people to lift things perfectly the right way, not perfectly the wrong way. And that's part of where my interest in sports medicine kind of started. It was kind of a mixture of that and my background in wrestling also that kind of started my interest as far as studying how the body moves. When I was a wrestler, actually, it was 180 degrees from what I do now, because wrestling is a very aggressive and oftentimes sadistic kind of sport and I learned from some of my very skilled wrestlers that taught me. They would tell me to kind of study my opponent. Look how they're moving. Okay, you see his ankle is kind of taped over there. He has a little bit of a bum ankle. You see how he has his fingers taped over there. See how he has a cauliflower over here. He's probably going to be doing duck unders on that side. Yep. And so I would study them so I could learn how to exploit their injury or their weakness or their insufficiency, so that I was able to have a mental advantage coming into the wrestling match. And so I had a strategy coming in, even if I was unfamiliar with that wrestler. Now 180 degrees as far as what I do is when somebody walks in, I look for these same things.
Nice.
I'm looking at what can I do to get them moving better? What can I do so that they're not having any kind of insufficiency, deficiency, weakness, instability? And so those are all things that I'm looking at to be able to help them rather than potentially hurt them. So.
Wow. So I like that. So you're talking about learning from wrestlers. So I take it you learned from like WWF, Hulk Hogan, Ultimate Warrior.
No.
It's a joke. I'm playing. Okay. Yeah, I know. I had to throw that in there. I'm an 80s, 90s kid. But also with that being said, I know that with sports medicine, there are other things that you treat. What are some of the, what would you say are treating sports medicine? What would you say is some of the main examples that maybe people do not hear more of, which is sports medicine?
Mhm.
So example, I used to be a tennis pro, so, I hear people saying, talking about pickleball, and I'm like, what the heck is that? It's not tennis, because it's different, but when I got to understand pickleball, to be honest, it's a lot like tennis. So what would you say some of the things that maybe there's like a misconception of understanding, maybe some other examples of what else would be also in the, I would say, in the box of sports medicine, if that makes sense.
Sure. And,
that we haven't talked about.
Yeah. And so sports medicine, again, we're almost saying that, some people, again, calling it sports medicine almost sounds exclusive. And so we almost say it's more motion medicine. It's movement medicine. We're trying to get people moving. And so, again, if it's a fracture, if it's a sprain, what do we need to do to get them to be able to heal, to be able to do that? But if it's a concussion, what do I need to, sometimes I have to slow people down so that they can speed up again moving forward. So sometimes we have to kind of, bargain, try to kind of figure out what we need to do. Now, also, as far as sports medicine, there's different kinds of sports medicine physicians.
Okay.
So, DOMD, after we decide that we're going to specialize, sports medicine, you can enter the field in primary care sports medicine from 6 different medical fields. So you can do it from family medicine, you can do it from internal medicine, from pediatrics, from emergency medicine, from physical medicine rehabilitation, and from osteopathic manipulative medicine. So 6 different pathways that you can take into that. As far as I know, University of Michigan is the only place in the country that has a neurology sports medicine, that after you complete a neurology residency, you can do a specified towards neurology sports medicine fellowship. So that would be a sports neurologist in that case. What I've done is family medicine and osteopathic manipulative medicine, and then I did a primary care sports medicine. Now, if you're an orthopedic surgeon, you complete your orthopedic surgery residency, and then you do a surgical specialty sports medicine fellowship. So some sports medicine doctors are surgeons. And so any sports medicine surgeon tends to have a lot of times extra expertise in regards to specialized treatments for shoulder, knee, and depending on where they do their fellowship, sometimes hip and elbow. A lot of times, a lot of it's very much an arthroscopic based kind of fellowship. I know that they do get some exposure to some of the things that we do within primary care sports medicine, but as far as managing things like concussion and all the other non-operative kind of things, that's where it kind of, that's where sports medicine really kind of, primary care sports medicine is really able to shine. And one of the things I like to talk about is, and I'm not saying all surgeons, I've worked with some excellent surgeons, but a lot of surgeons, we say it's like, surgeon's a hammer, patient's a nail. All the surgeon knows is how to do surgery. All the hammer knows how to do is hit the nail.
Exactly.
And so it's very just kind of black and white. And so it's either surgery or good luck. And in sports medicine, I say it's like, I recognize when it's, black and white, but I recognize all the gray in between. I call it the gamut of the gray. So we deal with all of that that's kind of in between there as well. And so, I would say my gray area, a surgeon might only say there's only this much kind of, there's surgery all the way here. And then, there's not much in between. I'd say that there are a lot of things in between. A lot of times there's certain things that we do in sports medicine and movement medicine and osteopathic manipulative medicine that just some people just don't even want to know about because it would affect their bottom line. Because if a surgeon's like, surgeons like to cut.
Yeah.
And so if a surgeon's like, well, I could send it to this other doc that would be able to do this, and then I wouldn't have to do the surgery. Well, that's not very good for their business. And so, so that's it. But what's interesting is I'm part of the American Osteopathic Academy of Sports Medicine, and our group has partnered with this group internationally, notably in Germany, this DAAO, and we've been teaching over there about how to do osteopathic sports medicine over in Germany. One thing that's interesting is over in Europe, depending on which country, a lot of the surgeons are, if they're incentivized based off of outcome more than what the procedure is.
Right.
So they can do a less invasive kind of procedure like osteopathic manipulative treatment or a regenerative treatment, and they're able to get the patient to the same outcome, then they're paid the same amount. So some of them are less incentivized to try to do these big expensive surgeries. And so we've been going over there and teaching for years. Prior to COVID, I had been over there for a few years. And and a lot of the group that was there was surgeons. There was some primary care, there were some physiatrists, but there was a lot of surgeons that were there, and they wanted to learn, how can I do other things beyond surgery to be able to help my patients?
Wow, I like that. It's funny. I love neurologists. I think that my personal opinion, I believe that every chiropractor that becomes a chiropractor should at least should be well studied in that. I mean, can we talk a little bit about your fellowship? What that means. I feel like our audience, I think it's very important that my personal opinion, when you're looking for a chiropractor, you're looking for a good doctor, that they have a fellowship. And I'd like to maybe kind of, if you wouldn't mind talking a little bit about that, because I believe it's very important, because when you talk about the function of the body and you go deep into that, it gives you more of an understanding on how to work on the body as a whole. I've gone to doctors recently, and I've compared doctors to neurologists and people that have a fellowship. And I feel like I get my money's worth, believe it or not, from someone that has a fellowship, because they're looking at my entire body, not just take a couple pills. Here's a patch. I'll see you next week. Let me know how you feel.
And to be honest, though, I don't know if that's always necessarily true. Sometimes people become so subspecialized that they only can look at somebody through the pinhole.
That makes sense.
And so, so let's talk about training. So, typically in American medical education, after you graduate from medical school, you do an internship, which is 1 year, and then you do your residency. And so your residency is anywhere between 3 to 6 years, depending on what your specialty is. And then after that, you can go out into practice, or you can do some additional training, a fellowship. And so I've done 2 different fellowships in addition to my residency training. And so I did my residency training was in family medicine, osteopathic manipulative medicine. I did a fellowship in osteopathic manipulative medicine as well. And then I also did a fellowship in primary care sports medicine. So those fellowships were each a year. Most of the fellowships in the country are 1 to 3 years, depending on what the training is. Most of the sports medicine fellowships, some of them have a little bit of a research component to it, or an additional research component to it, so they're 2 years. But most of the primary care sports medicine fellowships are 1 year. Most of the orthopedic sports medicine fellowships are 1 year. And during that, it's an intensive year of education, learning, by making sure that you understand all different aspects of treating, all different kinds of injury, really kind of a deep dive into anatomy, physiology, biomechanics, making sure that all those things are understood, various procedural opportunities, seeing a lot of patients within that field, and having formalized instruction to make sure that you're learning how to do things right from experienced individuals with credentials.
Right. No, I agree. I'll give you an example. Let's say I had neuropathy. If I had neuropathy, I don't, but if I did, we know that neuropathy is normally because of blood flow, and of course could be all sorts of things depending on what you're eating. And it's funny, if I were to go to a doctor, and I've seen this within my own family, if I were to go to I always look at it like this. There's 2 different types of doctors. Actually, there's 3. Yeah, it's like, if you need a surgeon, you need to be cut open because there's a situation, you got a car accident, something like that. I totally understand. But I've seen where there's been a lot of times where somebody did not need to be cut up, or it needed to be cut open, and it happens. But I always look at, there's 2 types of doctors. Some that will give you a little baggie with a bunch of pills to take, which that's okay if you need them. But the system wasn't created for you to get weaned off of those pills for, like, say you're utilizing neuropathy. I know that within my family, we've seen doctors that are neurologists and have literally been able to reverse, maybe not it to go away, but start to reverse it with what we're eating and by utilizing certain tools that doctors have. And what are your thoughts on that?
I mean, my thought is, and I teach medical students all the time and residents all the time. And I used to be a fellowship director for
Oh,
sports
nice.
as well. So I do a lot in medical education. But I say it's like, we as, one of the things that's valuable about going to medical school, about going through a residency, about going through a fellowship is you obtain a lot of knowledge and you learn how to learn, because we're never going to know everything. We're never going to know it. We keep learning new things. And, one thing that I say is sometimes with the patient, their condition sees us, but we don't see it. And that's where we're at the mercy of what our declarative knowledge is, how much we know what's going on with somebody. And so I see people all the time where they come into my office and within the first 5 minutes, I say that this is what it is. And they're like, I've seen 5 other specialists. Why haven't they been able to figure this out? And it's not that, that they just are holding back that information. It's just that they haven't learned that. And so that's one of the big things about, after kind of going through medicine, as far as all my training, I feel you develop a lot of fear and humility and respect for the human body, the human structure. It's like it takes an incredible amount of knowledge, and it's a continuous amount. I say we're professional nerds in the sense in that we're always needing to learn, we're always reading, we're always looking for further education. And if just like I say, motion is medicine, education is always in flux as well. When you stop learning, that's when you need to hang up your stethoscope.
Stop growing.
Yeah. So, I mean, I'm constantly learning, constantly teaching myself. And so then, I might see something that I wasn't sure about today. And in 5 years from today, I'll be able to say, no, I've read about that. I know what that is. And I've had things that I've been able to figure out on other patients just because I am able to kind of, access that declarative knowledge. And then I've seen it procedurally, how it can play out. And I know how to apply that procedurally to be able to treat the patient. Now, it's not to, I think that my background in primary care and family medicine has given me a good diversity so that I kind of look, at all the different systems. I don't just kind of focus in on this because somebody's coming in for a neuropathy kind of complaint. And so maybe if they go see the neurologist, maybe the neurologist is like, yeah, it's this neuropathy. And what I find a lot of doctors do is they treat the test rather than the patient. And that's always a disappointing thing too, because the patient I always, tell people the patient will tell you what's going on. We just have to be smart enough and informed enough to be able to figure out what they're telling us and recognize what it is. And so just because they have a label of neuropathy, don't just look at it through that neurologist kind of lens.
Because it could be something else causing that.
Yeah, it could be a trigger point of a muscle. It could be a vascular kind of issue. And so I need to have that differential. I need to make sure that I'm thinking and my brain is spinning, and I need to be able to identify and ask the questions and know the physical exam maneuvers to be able to kind of see, is this consistent with what's going on? I see people all the time that come to me for one thing, and then I end up diagnosing them with another thing. And it's not to discount what they came in for. And I need to make sure that they have that understanding. But that's the reason also that I try to be an imaging minimalist. I say it's like I do an excellent history and physical examination. And from that, I surmise, it's like if I have not been, usually with a history, I already have an idea about what's going on. Physical examination, I'm doing some maneuvers to help confirm or to, kind of either build or narrow down or possibly expand my differential as far as things. If I need to get labs, if I need to get imaging, it's because I need that to help characterize it better. But I don't get imaging just to get imaging. If it's going to help the management of the patient, the so what kind of factor, that's where I'm going to be getting those kind of things done.
Well, I like that. Well, it's like you said, treating the body as a whole, because some people will just focus on one thing. If I come in with knee pain, sometimes we think, well, it's my knee, but really it could be your upper back or your lower back, which can cause, I had that same situation. It's interesting. I had a slip disc and I was almost out of work for almost about a year. And I remember going to a chiropractor. I didn't want to go to a chiropractor. And I was going to other doctors. I was having the pills. Their pills were keeping me up. And then I saw a chiropractor, and he basically not only just straightened out my vertebrae a lot, but he gave me some tips on what I needed to do. I started following those tips, and one of them was swimming laps, believe it or not. And I couldn't even sleep on the ground. I mean, on the bed, I had to sleep on the ground because my disc was so messed up. And after 2 weeks of swimming laps back and forth, I was out of pain. I'm still haven't had pain, and that was like 20 years ago. But my point is, and where I want to kind of go into is, if I were to be treated at your office, how would that work? Do I just go in there and you set an appointment? What would the formation look from step 1, 2, and 3?
So, and again, my office is not the conventional office, because we are kind of, what I say is we're out of network. We're kind of out of the healthcare system. And I always like to do the bunny ears with the healthcare kind of thing, because it's a disease care system. It's not necessarily really giving physicians time to be able to spend with their patients to be able to provide help. So I saw a problem with the healthcare system, and I kind of said, you know what, I'm exiting from that. So the model that we have is we're out of network. So you don't have to have any kind of bureaucratic process or tiered process of you have to satisfy A, B, and C before you can do D, before this insurance company dictates this is going to be part of your care. And so pretty much if you said, hey, I want to come see Dr. Clearfield, all you have to do is get on the phone, get on your computer, and it's like an arrange for an appointment to come in to be seen. And it's as simple as that. And when you come in, it's like we make sure that we do a good, comprehensive history about what's kind of going on with you. But I like to understand what, it's like what your, past injury history or, sports and ortho kind of related history is, so I can see if there's anything from the past that might be manifesting in the present.
Right.
I want to understand what your current concerns are, what your goals are, so that I can see what realistically is a good kind of endpoint for you. Because one thing I tell my students all the time is that, I might see somebody and I could go exactly by the book. This is exactly what I need to do for you, but your expectation was different. And so I try to make sure I really elicit what the patient's expectations are. If the patient's coming in saying, I think I need an MRI for my shoulder, I can say, okay, why do you think you need an MRI for your shoulder? Let me tell you why I don't think that's going to be the best thing for us right now. I think this is the best place to kind of start, because based off your history and physical exam, I'm thinking that you have a little bit of a rotator cuff strain. Let's say that we get an MRI. Let's say that we, see that that's exactly what's going on. It hasn't changed anything, but we've had that extra expense. And so, again, we take a lot of doctors. We're kind of handicapped to the system because ultimately we keep getting paid less and less by insurance companies. And so pretty much that what instead of, if we want to be able to make any money to, keep our doors open, keep our families fed, that encourages us to spend less time with patients, more time on paperwork, and get more patients in. It's a numbers game, and I just said, and so a lot of us that, said, it's like, if I had time for this, if I had time for that, the patient's like, if my doctor had time for this or time for that, then a lot of time, time alone will allow you to be able to figure things out. And so having this model where we are just able to dictate how much time we have with the patient, and I can just say, this is how much I think my time is worth. This is not a completely innovative new model. It's the same old model that we had before insurance companies came in, before big hospitals and systems came in.
Right.
Physicians out, bought insurance companies out, and before they kind of essentially ruined medicine. This is the old doctor and the patient sitting across from them. This is how much this is how much it costs for this, and that's what we're going to do. It's very similar to getting your car fixed up.
Exactly.
Every time you need an oil change, do you use your car insurance? Every time you get a flat tire, do you use your car insurance? But if you get a flat tire, you're not going to drive on that tire, right? Because you're going to tear your car up. And
Exactly.
It's going to cost more money in the long run. So why is spraining your knee any different? But do we have to use our health insurance for it? And so I think, it's like I carry, I don't have routine health insurance for myself, but I carry catastrophic insurance. So if I get hit by a car, if I have a stroke, if I have a cancer, a heart attack, something severe, something with ridiculous kind of medical bills,
Right.
We're covered for that kind of thing. But as far as this routine stuff, I just pay out of pocket. Just because it's like, this is how much this is how healthcare really should work. We should cut all these other systems out of it. And you'd be surprised how cheap you can get things done when you're kind of working outside of these systems.
Yeah, I agree with you 100%. I like the way that you explained it. Very thorough. You're like, Mark, I do it all the time. Wow. Hey, I just want to, again, thank you so much for being here on the show. I love one of the things that I've learned today is, hey, it's not just motion is medicine, but with a with someone that works in sports medicine, it's not just people that are in sports. And I just want to say thank you so much for your service with what you do. I am very thankful that you were on the show to explain that. And I know that there's going to be some people that are going to be asking some questions and most likely be instant messaging me. This normally happens to me whenever I get on the show. One last thing before we leave. What's one last thing that you would like to leave with people that are maybe, there's some people that are scared of doctors, just like there's some people that are scared to go to the dentist. I hate to do the comparison, but hey, it is what it is. Let's say somebody that's in your area right now, and they've just seen so many doctors after doctors, and they're just like, you know what? No one's helping my neuropathy, or we'll say arthritis, or whatever it may be. What's something that you can maybe, kind of encouragement to them to whether see you or a physician that's in that has, that's been through a fellowship or anything.
And I guess as another selling point for just seeing a sports medicine physician, and regardless of DO or MD, I feel like a lot of sports medicine physicians very much carry a lot of these philosophical kind of things that I've been thinking about that is trained within the osteopathic philosophy. But I think there's a lot of MDs that embrace these principles in sports medicine. And the advantage of seeing like a primary care sports medicine physician like myself is many of us were very aware of what's in the box of conventional medicine, but we definitely think outside the box as well. And there's so many people that, I've seen so many people, I've seen ortho for this and that, and it's not sometimes their fault that, some of these other people don't figure it out. Sometimes it's that they only have a constricted amount of time. Maybe they're only looking at the image and they're not looking at the patient. But that's something that we are all trained to kind of really do. So from a sports medicine standpoint, there's so many different things that, and it's not just athletic kind of injuries. We treat, again, primary care sports medicine. So I can deal with, athletic heart issues, lung issues. I treat a lot, I work with our United States wrestling team and judo team. I see a lot of dermatologic issues in the athlete.
Oh, wow.
So, the range is pretty great. I actually have a lot of gastrointestinal doctors, GI doctors that send me their patients that have chronic nerve-related abdominal pain. And I'm able to kind of work on those kind of things. So it's like, it really kind of is a very cool field because it just branches out into so many different kind of areas of medicine. And so it crosses over into neurology here, it crosses over into GI or cardio or derm. It's really cool, just the vast amount of things that we're able to see and evaluate. And at the same time, I'd say that, almost all of us have great humility about what we are comfortable with and what we're not comfortable with. If I think this is something that needs surgery, now unless I see the bone hanging out of their arm, right, I never tell somebody you need surgery, but I say, you know what, I think this needs to be discussed with the surgeon.
Exactly.
The surgeon that I know and trust to get you to. So I recognize when it's something that's outside of my wheelhouse or maybe it's just something that I just shouldn't be managing myself.
I agree.
But those are all things that I would just encourage people to do. So, a lot of times you'd be surprised how much a sports medicine physician is able to help you out in so many different things beyond just an achy shoulder, an achy back. So just sometimes just finding yourself a local sports medicine physician can help. Now, if you're in my area, definitely come see me, again, North Texas area. And if you want to learn more about it, also definitely follow us on our social media. Our handle is MotionIsMed. And our website is motionismedicinedfw.com, DallasFortWorth.com. And so, yeah, definitely follow us. We try to really provide a lot of information to inform the public, try to show some of the various kind of procedures that we do. Today, we just filmed a procedure of us doing a sciatic nerve hydrodissection on somebody with hamstring sciatica.
Wow.
It's again, some people are like, I had no idea. I can't tell you how many people that said, I wish I knew that you did blah, blah this many years ago. And so that's what I'm trying to do. I'm trying to get the word out. I'm trying to let more people become aware of what we do in sports medicine and what I specifically do as an osteopathic sports medicine physician.
Thank you so much. I love it. Wow. Everyone, here's the thing. Sharing is caring. Please share this. If you don't have pain, I can guarantee there's somebody on your Facebook page, your Twitter, Instagram, any type of gram online, TikTok. Please let's share it because it's about helping one person at a time. And I know that's Dr. Daniel's passion. And thank you so much again for being here. And you're awesome.
Thank you. Thanks for having me. Yeah.
Thanks.